Every one of us has been a patient in a hospital numerous times in our lives, whether it be for physical or for treating an illness or for an emergency visit to the urgent care. Huge advancements in medical technology over the last few decades has given us extreme confidence in receiving any medical treatment. Even the most sensitive of procedures almost seem routine, yet even a basic procedure carries so many risks of becoming anything but routine, with injury and death a very real possibility. Even as we enter the midpoint of 2018, such medical advancements haven't yet been able to eliminate medical errors. With grave consequences, medical errors rank as the United States' third leading cause of death. According to a study done by Johns Hopkins, it is estimated that more than 250,000 people die each year from it. This statistic is all more shocking for the United States, which in 2015 alone has spent $3 trillion in healthcare, yet continues to lack an adequate healthcare system that ends with preventable injuries and deaths brought on by medical errors. Medical errors are mistakes that can arise during a patient's course of treatment. Physicians or pharmacists may misdiagnose the patient, provide the incorrect amount of dosage or incorrect course of treatment, which can lead to complications that can be fatal. Although Hopkins estimated the number that Americans are killed by medical errors to be 250,000, other studies have shown that it may have doubled that amount. The reason why it's believed that more people die annually due to medical errors is because statistics are collected by the Centers of Disease Control and Prevention, also known as the CDC, which failed to focus their mortality rates on medical errors and the underreporting by staff members. Medical errors are preventable mistakes done by physicians or pharmacists, and there are numerous ways to improve this epidemic. In 2008, Chris Jerry established the Emily Jerry Foundation. After his tragic loss of his 2-year-old daughter, Emily was given a fatal dose of sodium chloride in her IV bag while finishing up her last chemotherapy. Today, the Emily Jerry Foundation continues to advocate for the best patient care and heightens the awareness for the public regarding the unsafe pharmacy practices in the United States. As healthcare providers continue to make tragic yet preventable medical errors which can be tragically cost a person their life, Americans ask themselves whether our medical technology has really advanced throughout the years. In order to prevent these medical mistakes from occurring. The reality is that the current medical technology can drastically reduce or eliminate medical errors, and it remains one of the top solutions for improving patient care in the United States. By refining and modernizing physicians and pharmaceutical medical practices and further advancing medical procedures. Doing so can help reduce medical mistakes, which can decrease fatality rates. Barcode Medication Administration, also referred to as BCMA, is a medical technology system put in place to ensure that the patients are receiving the appropriate medication and the correct dosage at the correct time. This is done by adding barcodes to the medication and having the patient wear a wristband with the same barcode, and these are being scanned before the patient is being prescribed any kind of medication. BCMA is an effective line of defense in reducing medical errors by ensuring that the patient is receiving the correct treatment. BCMA helps to ensure all 5 stages of medical management process: right to patient, right drug, right dose, right routine, and right time. BCMA is clearly one of the best medical technologies in reducing medical errors, which makes it which makes it difficult to understand why only 65% 98.5% of hospitals nationwide have the BCMA system in place. BCMA has been effectively linked with other medical technology, the electronic medication administration records. Together, these two systems have been proven to reduce medical errors to 4.1 by 41.1%. If the BCMA system is the latest and most effective medical advance in technology, has been proven to decrease medical errors, why is it not being used by all these hospitals? Implementing the BCMA system to better patient care is easier said than done. According to the Leapfrog Hospital Survey in 2016, the cost for implementing the system is very significant, which could be one of the barriers on why BCMA is not being implemented. Over the 5 years to implement the BCMA system, it can cost between 35,600 to 54,600 per BCMA in every enabled bed. Medical mistakes are occurring in such an advanced society. Cost is obviously a leading factor in this. Patients need to become more informed with their own healthcare and learn to effectively question their primary care providers regarding decisions that can potentially lead to serious medical errors. Underreporting of medical errors can also make it extremely difficult to diagnose the problem in the healthcare system. Medical errors are situations that can be addressed by physicians and patients. Stating and addressing mistakes by physicians making during the patient's course of treatment can be terrifying. Physicians may fear that the patient and the family may not understand that the mistakes can occur because they're human and mistakes happen. Addressing the problem can be difficult due to the lack of adequate research. The underreporting of medical mistakes also play an underlying factor on why medical errors are lacking in necessary resources for effective preventable measures. Heart disease and cancer are leading causes of death in the United States. As such, both receive a great amount of resources towards the study of treatment and preventable measures for heart disease and cancer. These two causes are actually directly addressing the problem and giving the ability for patients to remain healthy and live longer. So the question remains as to why aren't the same dedication, resources, and fundings available to the third leading cause in the United States, which is medical errors. Organizations like the Emily Jerry Foundation are helping to build awareness and shedding light on the solutions that are already available. For barcode technology to electronic monitoring of medical information, so long as the necessary resources become available to reduce the amount of fatality for medical errors annually, BCMA will be the newest and most advanced medical technology implemented in hospitals, removing medical errors as a third leading cause in the United States.